Thank you very much, Mr. Secretary. I'll begin with the questioning. And one of the first things I'd like to talk to you about is actually something that is under the auspices of CMS. And I spoke with Dr. Oz last night about this. I'm sure you're very familiar with it, though. And that is that in the One Big Beautiful Bill, there's a lot of attacks right now going on publicly about hospitals are in trouble. And the blame for that is placed on the bill, even though the bill hasn't even been implemented yet. The fact is this committee held hearings on the troubles that rural hospitals are facing in the United States before the passage of the One Big Beautiful Bill. They've been facing difficulties in rural America for a number of years now. And the bill, the One Big Beautiful Bill, contained a rural health transformation program, which I would just like to ask you to comment on. This is the program which allocated $50 billion over the next 5 years to our rural community hospitals in the United States to help them deal with some of the financial crises that they are facing and transition to more stability. Could you comment on that program that is in the One Big Beautiful Bill?
Yes, Senator. One of President Trump's campaign promises and one of the principal preoccupations, not only of Republican senators when I did my confirmation hearing, but also almost equally among Democratic senators, was crisis in rural health. We've had 120 rural hospitals close over the past 10 years. These institutions are not just delivering health access to rural Americans, but they are economic centers, they are cultural centers for those communities. They are often the largest employer. They are the highest paying jobs, and they are the centerpiece for those communities. So when they die, the communities collapse. And President Trump promised to do something about that, and he has delivered on that promise. Right now, we spend about 6% of Medicaid funding is sent to rural hospitals, a very, very tiny slice, and that's one of the reasons they're in trouble. President Trump has now allocated through the One Big Beautiful Bill $50 billion, so $10 billion a year over the next 5 years. What we give to rural hospitals, that 6% represents $19 billion a year. So we're increasing that by $10 billion. So we're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. There's never been anything like that in history. It is the biggest investment, and it should stem this hemorrhage.
Well, thank you. I appreciate your giving clarity to that, because it is frustrating to see these continuous allegations that the difficulties that our rural hospitals are facing all were created in the last few months when we passed a bill, when we've been holding hearings in this committee about these problems. And in the bill that we passed, we gave a $50 billion boost to, as you indicated, increase by 50% the federal support for our community rural hospitals in the United States. And I think that the hospital owners understand that. They recognize this support. In fact, they are coming they're coming together very carefully with Dr. Oz to work on the rollout of this program so that we can see this boost and this support that is coming. Just another one of the disagreements we have about what really was in the One Big Beautiful Bill. So I appreciate you commenting on that. In the last minute and 10 seconds that I have with you, could you just quickly talk once again about the broad issue of making America healthy again in terms of our aim to change the healthcare system's focus from a reactive symptom management model to one that focuses on lifestyle choices and the root causes of chronic disease?
Yes, Senator. You know, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent $0 on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause, it's increasing, and all of the arguments that Republicans and Democrats have about single payer, Obamacare, or with the various ways of allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at the CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
And
Mr.
I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to cut myself off to make sure I keep to this time frame.